The first, I would say, is Zika. Just last month, the head of CDC admitted it's out of control and we don't have a way to control it in the U.S. Our response plan is too little, too late. And I think what he was acknowledging by that is not that there aren't effective things to do, but this came fast. It had been ignored because these have been very minor outbreaks pretty much up until 2014, 2015 in much more remote areas of the world that didn't involve the U.S. Well, we now have local transmission in Florida. We have just recently learned of local transmission within Texas. And we've got about 30 or more U.S. states that are at risk for this spreading to. We're in the wintertime right now, so I expect that other than the very southern rim of the U.S., we won't see a lot of activity. But as springtime comes, I think we're going to be in for a rude awakening in terms of the damage that this virus can do. The second would be the complications of bacteria that are multiply drug resistant. And I'm sort of mixing two stories, particularly as this occurs in the hospital and then diffuses out into the community. So we've got some very bad bugs that are the result of misuse of antibiotics, primarily in other areas of the world, but it occurs in the U.S. too. And anything that occurs anywhere else in the world is 12 to 24-hour plane ride away from us in the U.S. Some of these bugs, for example, C. difficile, can be very difficult to treat. We now have a great option, fecal transplants. Terrible concept, but it's almost like magic in terms of how this works.